Hey there! If you've come to this video looking for information about jaw pain, also called TMJ, TMD, TMJD, then you've come to the right place. In this video, I'm going to show you the do-it-yourself recommendations that I would make to my patients, family, and friends if they had jaw pain. So I'm Doug Grofeld. I've been a practicing acupuncturist for over 15 years. I've treated thousands of patients, and I'm now a recently certified health coach. Jaw pain can be a tough one because we're constantly talking, eating, and unfortunately for many sufferers, grinding our teeth, which is often unconscious in itself. Everybody's situation is going to vary, but in almost every case that I've seen, both joints of the jaw are affected. There's usually one painful side, or at least more painful side, and the muscles on that side are often really tight and can even limit how much you can open your mouth. The other side is usually less sore, and the joint itself can actually feel a little loosey-goosey. If you feel both sides as you open and close your mouth, you can often feel a little play in the joint on the less painful side. It will kind of do this little kick out to the side on the open and close path instead of the normal just forward and down. The good news is I have some tips and tricks that I've seen really help people if they put the time and effort into it. All right, let's get to it. I'm going to start with some neck massage. I'll basically be doing a mix between acupressure and trigger point release. Basically, I'll be finding certain areas where the muscles are tight, pressing on that spot until I feel some tenderness or some tension, and then holding that pressure, not increasing it, until I feel it release. So press, hold, release. Sometimes I'll add a little movement at the hold stage to help that release. First, I'll start with the scaling muscle thoracic outlet area release. It's located behind the collarbone, about a third of the way down from the midline to the shoulder, right where the collarbone itself flares out, right in here. I'm going to find the sore and tight area behind the collarbone and down, right in here. But before I do that, I'm going to press lightly in this area, make sure I don't feel a pulse. I do not want to choke myself out. So I'll press down on that spot until I feel the tension, right in there, hold, and I'll move my head side to side until that tension releases. You'll feel it just sort of let go. Once that happens, I can, in the same area, find another tender spot and do the same thing. Once I relieve all the tension in this area on both sides, then I'll move on to the upper SCM muscle release. The SCM muscle attaches to this bony area that drops behind the ear. The point I'm looking for is directly below that bone in the heart of the muscle. Same thing, press, hold, release. I can use my thumb on the same side to get in there, or I can even do a little reach around with the other hand, whatever works best and is easiest to maintain. Now I can just hold this one to release it, or I can open and close my mouth if that doesn't aggravate the jaw pain itself. Once I get these dudes released, I'm on to plucking the ropey muscles on either side of the spine. These ones are hard to release in the same way, so I'll start at the base of the skull and work my way down doing cross fiber manipulation or plucking. I'll do this a few times on each side. It doesn't matter if I go from the outside to inside or inside to the outside or both on the pluck. The next point to release is behind the earlobe and behind the jaw. First, I'll check for a pulse. Nope. This spot's usually a little tender, so no need to crank down on it. I'll just get in there and hold. Once I release both spots, then I'm going to move on to the secret spot, the spot where most of the magic happens, the muscles underneath the jaw. While everything I'm doing here is important, I think this move might be the most important. I'm looking for tender points up and behind the jawbone, right alongside of it. Mostly this is just going to be in the front half of the jawbone. These spots are tender. Remember, I just want them to release. I don't want to punish them into submission. So once again, I'll make sure there's no pulse, and then I'll press, hold, wait for it to release, and let go. There's no movement in this one, and you're going to do both sides. Woo! That last one was intense, huh? Okay, good work. Now we're going to move on to the jaw itself. First, I want to determine if there's a tight side and a loose side. Usually the tight side is the more painful one, and it tends to have more tension in the muscles of the joint. The loose side tends to be less painful, and usually I can feel some like sideways play in it when I open and close my mouth. So I'm going to focus my efforts on the tight and painful side. If for some reason both sides feel equally tight and painful, then I'll just work on both of them. I'll start with some press, hold, release on any of the tight spots of the masseter muscle. It runs from the corner of the jaw to the cheekbone. The cheekbone is this area right here, and its fancy name is the zygomatic arch. Once again, I'm not trying to smash these guys. Just enough pressure to elicit some minor pain and feel it release. Now, if my jaw was really out of whack and sensitive, I might even brace the other side. I'll start at the corner of the jaw and just work my way up. On to the temporalis muscle. It goes all the way from the side of the head, under the zygomatic arch, and attaches to the jaw. I'll start with a little cross fiber manipulation. Get this whole area up top. Once I get it all warmed up, I can hit this area right above the zygomatic arch. That's this area right above here, with some press, hold, release. I'll get the whole area above the bone, and if it's not too aggravating, I can open and close my mouth to help with the release. And then on to the joint itself. This whole area right underneath the zygomatic arch. So no hard pressure here. I'm just going to do some light rubbing through this whole area to get the blood flowing. Finally, we'll end with some similar light massage on the whole of the loose side. We'll start up in the temporalis muscle. Nothing crazy here. Just enough to get the blood flowing. Yay! I've gotten through the most important part, the massage. While the rest of these techniques are extremely helpful, the massage is still by far the most important. It's hot hammer time. The hammer of choice is the 16-ounce ball peen hammer. I'll heat it up with a gas flame or with hot water. And of course afterwards, before I use it, I'll make sure it's not too hot to the touch where it burns me. So I can work the SCM muscle that we talked about earlier. And the muscles beside the spine. And of course I'm going to be careful not to hit any bone, the spine, the skull, or any area where I can feel a pulse. Then I'll use that hammer to rub the masseter muscle and the temporalis muscle. And I'll hold it right over the joint itself and let the heat penetrate. I'll do this on both sides. Any other heat therapy over these muscles in the joint is great also, just no ice. While not an absolute necessity, a nice addition to the mix is a good liniment. My favorite store-bought for jaw pain is Posamon medicated oil. It has a slight analgesic quality, that's pain relieving, and from a Chinese medicine perspective, it helps promote blood circulation. Another liniment that would be especially good for tight muscles is magnesium oil. With either kind, I'll just apply them liberally to the jaw muscles, to the joint itself, and even on those neck muscles that we talked about. Feels good. On to laser therapy. Do I absolutely need a laser to treat my jaw pain? Nope. Are they relatively expensive? Yes. I've only been using the laser for about 5 years. Prior to that, I treated lots of jaw pain successfully without. But that being said, since I've had one, I felt like it's really made a difference and helped speed up treatment quite a bit. So, if I was doing all the other stuff, doing all the massage, and it just didn't seem to be getting the job done, it might be worth the investment. Otherwise, just hold off. First things first with lasers, I need to be careful. I don't want to shine it anywhere in or around my eyes. So this is the one I use. I'll do 3 minutes on the tight, painful side, right over the joint. And then I'll do about 5 minutes on the loose side. I do a bit more on the loose side in the hopes that it will heal and tighten up the connective tissue and ligaments around that joint, as opposed to the other side where I'm basically using laser just for its anti-inflammatory properties. Another thing not entirely necessary but definitely helpful is the Chinese herbal formula Tong Xiao Ho Shui tea pills. Don't worry, you don't have to write that down or memorize it. It will be linked below. This is a great formula for any sort of head pain or ache, and from a Chinese medicine perspective, it helps speed up the healing process by promoting blood and energy circulation. Woo! That was another long one. The good thing is, once someone has this all down, the routine can be burned through pretty quick. Unfortunately, jaw pain can be persistent, so it's good to kick in the willpower and keep at this for a little bit. And for those of you who grind and clench your teeth, I've made a supplemental video for that. This has to be addressed if you want your jaw pain to heal. So if need be, go check that out. You can find even more information and links to everything I've talked about at my website, dougsdose.com. And please do me a favor, subscribe to this channel. And if you're a total baller and this video did you some serious good, please consider showing your support by leaving a donation through the link below. Take care, be well.